Hello, my name is Sarah Blackburn and I'm an occupational therapist. I'm going to tell you about my job today, the skills that you need to be an occupational therapist and the opportunities that are available for you in the career. So I'm the head occupational therapist at Pilgrim Hospital, but also I lead the service across the trust. That's in all 4 of our hospitals, at Grantham, at Louth, at Lincoln and Pilgrim. I've been an occupational therapist for 31 years, nearly 32. It sounds an awfully long time when you say it, but it's gone so quickly. I can honestly say it's the best profession for me, and I've never regretted one day of being an occupational therapist. I trained in Derby all those years ago, and in those days it was a diploma course. Nowadays, most courses are degree level or masters. To be an occupational therapist, you do need some skills, some quite specific skills. And I would say the first of those is being able to be a good communicator. You need to be able to talk to almost anybody, young or old, from whatever background, being able to talk to somebody comfortably and have a good conversation with them. But equally, you need to be a good listener. You need to be able to listen and see the clues that they're giving you. Because what you want to find out is how they live their life and what matters to them. As an occupational therapist, we very much work in partnership with people to try and enable them to overcome the difficulties that they're having. Now, we work in different areas, and my area of specialty is in physical health. So generally you come to one of our hospitals when something has gone wrong for you with your physical health. You may have had an accident, or you may have had an illness, or you may have been born with something that is quite challenging. And as occupational therapists, we work with people of all ages to help them overcome some of the barriers to independence. That may be things like things that are important to you. What's important to you to be able to do every day? Could it be cleaning your teeth? Could it be walking? Could it be getting a job? Getting outside and getting to the shops, going to your social groups. When there's a barrier in your way, a physical barrier that stops you doing that, we work with the person to overcome those things. So the skills, you have to be good at working with people. You have to be quite creative. You have to have an awful lot of common sense, because you can guarantee the answer isn't in a book. So you need to think about things that you might have seen before, or that might work, that actually you're prepared to try together. So being able to work in partnership with people, I think, is one of your key skills that you would need to have. There are other things that help, like being organised, because we do have large caseloads. You know how big our buildings are, and they are full of people, and we work on the wards with people that are having some of those life challenges. So it could be that somebody you know has fallen over and broken their hip, and they can't walk so well, which means they can't get up their stairs, which means they can't get to the toilet. So how does an occupational therapist help them unpick that and enable them to go home and live the life that matters to them, that's important to them? We do what's called rehabilitation. You may be familiar with that word, and that is about practicing and helping people overcome those difficulties. So we might work alongside them and be a partner with them in their care in trying to help with rehabilitation. So practice the skill time and time again, giving words of encouragement, helping them when they just want to give up, so helping them carry on and find that solution. So working in partnership, repeating the skill. It might be that as an occupational therapist you actually know another way of doing it. So you've always got dressed a certain way, sitting on the bed, lifting a leg up, putting your arm in your blouse or your jumper. But actually, when something gets in your way, say if you've got a broken shoulder, or you've broken your hip, or you've had a stroke, something like that stops you. It prevents you from getting dressed in your normal way. And all of a sudden you feel stuck. You just think, I can't do it. But actually along comes the occupational therapist, and we sit with you and we work again in partnership. We try and do it your way normally, but actually if we can't work your way, we may well be able to suggest a different way of getting dressed, a different position, a different way of moving your leg. and things that you might not have thought of. And our last resort is we do have some equipment. We have assistive equipment which we prescribe, and so you'll be familiar with some of those, like commodes and wheelchairs and grab rails and walking sticks. Those sorts of pieces of assistive equipment help people regain their independence and can be absolutely fabulous. And it's an occupational therapist that you would see for that expert opinion on what to prescribe. The opportunities, wow, within occupational therapy, it's a growing field. It's everywhere, because actually a lot of what we do is what's called self-management. We try and enable the person to overcome those difficulties they're having by self-management, by showing them ways that they can look after themselves. So some of that is around long-term condition management, and we'll do that with people. So the opportunities in United Lincolnshire Hospitals, I have nearly 100 staff. I'm hoping to get over 100 staff soon. So 100 occupational therapy staff. Now they vary from assistant staff, which starts at around £18,000 as a salary, right the way through to managers and leaders in the organisation, where the world is your oyster. So we have occupational therapists working in all those areas. A new graduate would graduate on a salary of about £25,000. So our staff is made up of assistant staff, which we call unregistered, and registered staff are those that have done the professional qualification of occupational therapy. And like I say, they start at approximately £25,000 salary and can go upwards. The world is your oyster. We support people at all stages of that career development to be able to get the best that they would like, their career development. So if somebody joins us at the very sort of entry level and they're really interested in occupational therapy, we support them with different opportunities to be able to get to wherever they want to be. And we have examples of that in United Lincolnshire Hospitals, where people have joined us at entry level and are now leading teams in occupational therapy in a particular specialty. So we've supported them to do their training, and they've done more. They've done more. When they've graduated, we supported them to do further qualifications, postgraduate education, so that they get really good clinical skills or management skills. So there's lots of opportunities. We advertise whenever a post comes up. We'd like to go externally. We'd like to have people coming into our profession. Like I say, remember, it's those skills about being really good with people, a good communicator, a confident person helps, and having a whole lot of common sense, being able to work your way around some problems. So that's occupational therapy in a nutshell. I look forward to any of you getting in contact if you're interested. Thank you very much.